Although I represent European Cancer Patient Coalition, I will tell you about something about what the situation looks like in Poland in case of pharmacovigilance legislation process, and also some perspectives. Because we are run of time, so I want to speak about ECPC activities available on our website, but the main mission and the main sentence could be defined as nothing about us without us. It's the most important fact in ECPC activity. The main activities are patient education, patient involvement, healthcare, and cancer policy. EU-funded project research and working groups we are involved in. We are developing working group now. And the main subject, pharmacovigilance in Poland. The past, through several years, only professionals, doctors and pharmacists, were authorized to report adverse drug reactions. There was no information, any kind of information for patients, and the public awareness on pharmacovigilance among Polish patients was terribly low. And there's also a great lack of communication between patient and the doctor in case of Polish doctors, because they are not well educated within communication. And of course, a low level of awareness on adverse drug reaction reporting about primary care physicians. How the situation look at present? The adoption of the directive is still in progress, and unfortunately, according to current regulation, patients are still not allowed to report directly adverse drug reactions. But we have stepped forward. There are electronic forms available for reporting adverse drug reactions, so we have a little bit mess between mandatory law and with what is going on in reality in Poland. Oh, sorry. And one step backward, patients are not informed by professionals of electronic form existence at all. And when there is an ADR, patient is along the first cycle. So patient who wants to report an ADR fact can report by electronic form ADR, and then the ADR is assessment. There is a great assessment of ADR, and only one recommendation, always one recommendation: go to your doctor again. So there is quite a nice cycle. After that cycle, there is a process. Oh, sorry, once again. Oh, excuse me. Oh, we have the second is the process. Patient goes again to the doctor, and doctor is reporting the ADR, and the report is transferred to the institution, and institution is then again there's an assessment of this ADR fact, and then perhaps this assessment and ADR report goes to Swierzewski's system. And patient involvement is only at the first stage, only when there is an ADR effect and ADR report, and that's all. For the rest of stages, patient is absolutely excluded. So there are some discrepancies about reporting any kind of ADR. We have possibility to report by e-forms, but the e-forms can be prepared by private company or pharma consulting companies, law firms, other like, for example, NGOs even. Or the institution. The institution is Pharmacovigilance department in the Office for Registration of Medicinal Product, Medical Devices and Biosimilar Product. So we currently do not know where, in fact, e-reports go, or to private companies, consulting companies, law firms, NGOs, or to the institution. A little bit different situation is when a patient goes to the doctor and reports that ADR. From the doctor, the report can only be distributed, I presume so, to the institution, the pharmacovigilance department. So, as I previously said, there's no communication not only in between a patient and the doctors, but also no communication between private companies and the pharmacovigilance department. Professionals are obliged to report each ADR case, but it's unknown if the report is directed to pharmacovigilance department or private company. The patient situation is with reported ADR is the same as always. Thank you for your cooperation. And Francois indicated Poland in yellow. That is the lack of information. And I received from this pharmacovigilance department some data for 2012. So over 1,000 ADA reports from professionals, 1,500 reports on adverse post-vaccination reaction from sanitary epidemiological stations, and over 4,000 ADA reports from responsible entities. I have no idea what that means, responsible entities. I have to admit that I needed some test, and I did it by myself, just going to the pharmacy and asking people what they know about the pharmacovigilance regulations. And there were 3 questions. Have you ever been informed by a doctor of ADA reporting possibility? Have you ever been informed by a pharmacist of ADA reporting possibility? And have you ever heard about new pharmacovigilance legislation? I mean, possibility of direct ADA reporting, because this is the most important. And 3 possible answers: yes, no, and don't remember. So those are the results. 11% for yes, if they were, in fact, informed by a doctor that they can do some ADR. And unfortunately, 58% no. And 38 do not know at all, or don't remember. A little bit better situation is within a pharmacist, because it's 7% who declared that they were informed by a pharmacist about possibility to report an ADR. And about new legislation procedures, unfortunately, almost no one heard about that. Only 6% were just heard something about pharmacovigilance legislation. And the perspective is, of course, as a patient representative, I would like that whole implementation of the directive. There must be also clear regulations in Poland. And of course, we need patient education and more patient education. And what is very important, we need also mandatory physician education, how to contact with the patient and how to inform the patient that there is a possibility to report a fact of adverse drug reaction. And of course, there's a great opportunity now for patient organization in Poland to establish a cooperation between the organizations and the Office for Registration of Medical Products, I mean the Pharmacovigilance Department, because we need a public campaign on pharmacovigilance regulations and patients' right to report ADRs. And my personal impressions. Really, it's true that patients are aware about their right to report any ADR. They don't need any kind of regulations and for that. However, they do not know how, when, and to whom they can report. And it is obvious, but the greater patient awareness, the more efficient and effective treatment. It's quite obvious for us as patients. And thank you very much for your attention. It was a great pleasure to report that situation in Poland here. Thank you. Oh, 1 point more, excuse me. I would like also add about something about ECPC. You have mentioned that there is a SMART group, Signal Management Review Team, yes, in Prague. And ECPC now is a participant of eSMART project. And eSMART project within the 7th framework program is e-symptom management using advanced symptom management system remote technology. And ECPC is only the patient organization included in this project. And the main objective of eSMART project is that patients are monitored directly from mobile phones because they can report blood pressure, they can report temperature, and to the main database. And so they are monitored very well. So it could be then after several years implemented also within the pharmacovigilance system.
Absolutely. Well, thank you very much indeed, Rafal. That's a really helpful perspective. And I think we've now had some really common messages coming through from the patient perspective. We still have a long way to go on communication, but we also have to think about the practical methods of reporting. There may be web forms, but we need to be sure that people are aware that they can, how to do it, and have an expectation that it will be received in the appropriate way by the appropriate authorities. I think your ECPC initiative, using phones, etc., we really must make sure that that's factored in, particularly with the Web AE initiative that the Commission IMI will be taking forward. So thank you for that. Does anyone wish to ask Rafal any questions? Thank you. Ilaria.
Oh,
no, it's not.
Hi, it's Ansela from Hi Europe. Thanks for the presentation. I just have one question. I think you mentioned that in Poland the regulation does not allow yet patients to directly report on ADRs. Are you aware of other member states where with the same situation?
No, unfortunately, I'm not aware about other member states. But you see, as I said before, it's a complicated situation in Poland because the law says that it is forbidden for patients to report, but the e-forms are available everywhere almost. So it's quite in Poland like this.
So some disconnect there, but
Yes.
At least we've got it in our sights now. Any other points anyone would like to make? Well, we've really had an enormous value from our 3 patient representative contributions, and I know that there'll be a good consideration possible in the Patient and Consumer Working Party of the types of guidance that can be, if you like, syndicated from EMA, that can be adapted at different member state level. The toolkit approach from EPF sounds extremely valuable, but we need to keeping on. The sorts of levels that we've just heard about of knowledge, 1 in 10 people and so on, is really not acceptable. So a long way to go.